Hi, I'm Dr. Rajeshwaran, consultant endocrinologist and bariatric physician. So I keep getting asked by my colleagues, by my surgical colleagues and dietitians, what's the future of obesity medicine? Well, if I think back 20 years ago, what I was doing was, with the help of my dietitians, you're helping people, advising them to eat less, exercise more, drink a lot of water. And then slowly it's evolved. Now there are new medications. There was orlistat, and then there were a lot of other medications which got banned because they had serious side effects. And now we have got glucagon-like peptides, like the Wegovy and Zepbound, Mounjaro. They're very good medications. But then there's a huge cohort of patients of mine who do not respond to this group of medications, or they have side effects, or they cannot tolerate. But there's a huge number of molecules on the pipeline for obesity management. And that's going to be released probably in the next 2-3 years. You'll see that there are newer and newer medications. But what's the future? But what I feel is, in future, people with obesity will be on 3 or 4 medications. Just like diabetes, they're always on 2 or 3 medications, with or without insulin. People with high blood pressure on 2 or 3 tablets to get the blood pressure down. This is exactly what's going to happen with obesity management. People will be on a tablet which prevents absorption of food. They'll be on an injection which reduces their appetite. They'll be on a medication which bulks up their muscle mass. So there'll be lots of different, it'll be a multi-pronged attack. That's what I feel. But is this the solution? I don't think this is the solution, because this will only manage diabetes. It's not going to cure diabetes. It will not cure obesity. So obesity will never be cured. It can be managed just like diabetes, just like hypertension. And then, more importantly, people will start to accept. For example, in the United States, if you see, people have started to accept if your body mass index is 50, so what? Either it's because of frustration that they have failed with the surgery, failed with medications, failed with all the interventions. So they said, well, it's okay to be like this. And the society has started to accept. So there's a brand dilution, but which is more frightening. So when you have a higher body mass index, you're more susceptible to medical conditions like diabetes, cancers, heart attack, stroke, blindness, liver cirrhosis, and liver problems, and liver cancer. So that is the worry. And also then on the flip side, what I see is from my patients is there are novelty seekers. That means they jump from one new medication to another. They want quick solutions because that's how they've been programmed for the last 200 years. They feel that if you put on weight, you need a quick solution. You need, just like fever. If you have fever, in 3 days your fever should go. So this particular mindset has to go. So obesity is a chronic disease. You don't have to lose weight in the next 1 month or 3 months. So the mindset has to change. If the mindset changes, people will not jump from one medication to another new medication. So acceptance is okay, but the mindset has to change. This is why there's a plan to change obesity into a term called ABCD, which is adiposity-based chronic disease. It's a nice combination of 4 words, and which actually tells you exactly what's going on. Adiposity-based chronic, and it's a disease. So if people start to think that it's ABCD, then they'll be more happy. So the answer to the question, what's the future of obesity management? Well, it will be managed better, much better, with a combination of medications, psychological interventions, but there'll be no cure in the next decade.